Now look at liver cirrhosis. The objectives of this lesson are to define liver cirrhosis, to state the causes or predisposing factors of liver cirrhosis, to discuss the pathophysiology of liver cirrhosis, and to describe the management which includes the investigations you're going to carry out, the treatment that you're going to give to this human being, and the nursing care that you're going to give to this patient. So liver cirrhosis is a chronic progressive disease of the liver. And this progressive disease causes extensive degeneration and destruction of the liver parenchymal cells. The word parenchyma means the cells of a particular organ which carry out the actual function of the particular organ. So in the liver, the parenchymal cells we have are hepatocytes, and then in different organs we have the actual cells. So for example, the cells of the cardiac muscle, those are the parenchymal cells of the heart. So liver cirrhosis is a late stage of scarring, okay, fibrosis, when there's a wound and then there's healing. And this healing happens and scar formation happens. That is what is known as fibrosis. So it is the late stage of scarring of the liver, and it is caused by many forms of liver diseases and conditions such as hepatitis and chronic alcoholism. Each time the liver is injured, whether it is by disease or by excessive alcohol consumption or any other cause, the liver will try by all means to repair itself. Now, once it tries to repair itself, it's going to be injured in the process, and then there is going to be healing by fibrosis. Now, during the healing process, the fibrous tissue, okay, which forms will convert the normal liver into abnormal nodules. So the liver structure is going to change, the architecture is going to change, and abnormal nodules will form on the liver. The progression of liver injury to cirrhosis may occur over several weeks or 2 years. And so this is how the liver is going to be. This is the normal liver here. It is smooth and nice, but the cirrhotic liver has a lot of nodules and it is hard and it is much, much smaller. It atrophies. What are the predisposing factors to liver cirrhosis? Dietary deficiency, okay, one of the predisposing factors is, for example, in protein energy malnutrition and in severe kwashiorkor. The second predisposing factor is alcoholism, okay. Now, when people who are, you will notice that most people who are alcoholics rarely eat proper meals. They will rarely eat proper meals. Therefore, you're going to notice that their liver is going to, it is not going to be managing to perform the functions that it is supposed to perform because of poor nutrition of this human being. And apart from the poor nutrition, the alcohol will keep injuring the hepatocytes, and as the hepatocytes are trying to heal themselves, they end up getting injured as they heal. Alcohol alone has a direct hepatotoxic effect on the liver because it is known to produce necrosis of the cells of the liver, and it also allows for infiltration of fat into the liver cells. The other predisposing factor is hepatitis. Now, hepatitis, we already talked about hepatitis. It could be viral or toxic hepatitis. Okay, this is chronic inflammation. And then when there is chronic inflammation, the cells will start necrotizing. Okay, meaning they'll start kind of rotting. And then there will be fibrosis, and the ultimate result is cirrhosis. Another predisposing factor is parasitic infections, a parasitic infection such as schistosomiasis, bilharzia. Okay, this is a condition where the worms, some of the worms will go into the liver, and so you find that there's going to be healing. We'll look at bilharzia in detail. The liver will try to fight off the infection and start healing by fibrosis. Heart failure. Heart failure is one of the conditions which results in congestion in the liver because there'll be backflow of blood from the inferior vena cava to the liver, and therefore you find that the liver is going to be congested all the time, and therefore it is going to be to start becoming cirrhotic. Some metabolic disorders such as diabetes mellitus and then blocked bile ducts. Bile is produced by the hepatocytes and then taken to the gallbladder through bile ducts. From the gallbladder, it is taken into the duodenum where it is used up in the digestion of fat. However, if any of the ducts along the way is blocked, so the bile which is being produced by the liver cells will back up and it will remain in the cells, and therefore there will be destruction of these liver cells and cirrhosis will occur. The other predisposing factor is autoimmune hepatitis. This is where the immune system will start attacking the cells of the liver. And because of this attack, the liver cells will start being inflamed and they're going to start healing by fibrosis. The pathophysiology of liver cirrhosis. So repeated liver damage from various causes such as viral hepatitis, alcohol abuse, non-alcoholic fatty liver disease, or any of the predisposing factors that we have discussed earlier will lead to inflammation and oxidative stress. The cells known as hepatic stellate cells or Ito cells or fat cells which are in the liver will start transforming. These cells will start becoming myofibroblasts. Myofibroblasts. Fibroblasts, if you remember when we did connective tissue, are the ones that have the function of producing connective tissue and the extracellular matrix of connective tissue. And so you find that these myofibroblast-like cells will start producing extracellular matrix, such as collagen, and this is going to promote fibrosis. The accumulation of extracellular matrix proteins leads to the formation of scar tissue, which distorts the normal liver architecture. Okay? Now, the liver will attempt to regenerate. Okay? And this will result in the liver forming nodules of hepatocytes that are often dysfunctional. Several nodules will start forming. The liver will enlarge and it's going to be loaded with fat. Now, these are the initial phases. Now, with time, the liver cells will start being destroyed. Once they get destroyed, they're going to be replaced by scar tissue. And then the liver is going to shrink, and then it will become very hard and will have a very rough surface. It will have problems carrying out normal function, and the patient becomes jaundiced due to failure of the liver to conjugate bilirubin, okay? There is increased resistance to blood from the digestive tract, which normally flows through the portal system to the liver, okay? So there's increased resistance to blood. Now, what this means is that there is this blood coming from most abdominal organs, okay? Some blood will come from the large intestine, some blood will come from the small intestine, some blood will come from the spleen, some blood will come from the stomach. All these blood vessels, all these veins are going to join this big blood vessel here, which is known as the hepatic portal vein. The hepatic portal vein is the one that takes blood first to the liver before this blood goes anywhere else. When it comes from the GIT, when someone has eaten something or drunk some alcohol, whatever it is that gets into that blood is supposed to be detoxified by the liver.